Hi everybody, how are you? This is Dr. Dr. Djamina Handojo, and today is Saturday, April 11, 2026. I pray that God bless you, bless your study, bless your life. Let's study together. Let's do the review hematology. I already have two YouTube video about hematology, part 1 and part 2, but this one I want to use the flashcard. So let's do the review for this hematology, blood and lymph. When you answer the question, don't forget strategies, assess before intervention. For your prioritization, remember ABC, airway, breathing, circulation first, right? Safety. Prioritize patient that unstable, compare with stable patient. Unexpected sign and symptom, of course, more important than expected. If doctor says start, do that. Some patient with infection or hypoglycemic maybe need your attention first, compare with other that stable. Stem cell, right? This is the blood stem cell. It become myeloid and lymphoid. The one that myeloid will mature, become red blood cell, platelet, and myeloblast. Myeloblast become neutrophil, basophil, and eosinophil. So this is from the myeloid side. The other side is lymphoid. Lymphoid become lymphoblast, and then when it mature, it become B lymphocyte and T lymphocyte. Alright, so the stem cell of the blood, it become myeloid and lymphoid. The one that myeloid become red blood cell, platelet, and myeloblast. Myeloblast become neutrophil, basophil, and eosinophil. These are three cells that have the granule inside. So if somebody have leukemia that myeloblastic, that means in their bone marrow, you will find a lot of neutrophil, basophil, and eosinophil. That's why we call that leukemia that myeloblastic. It's from the myeloblast class, right? The other side, lymphoid become lymphoblast, mature become lymphocyte. So if somebody have lymphoblastic leukemia, right? If we call that lymphoblast leukemia, that means in their bone marrow there is a lot of lymphocyte. So lymphoblast become B lymphocyte and T lymphocyte. B lymphocyte or plasma cell is the one that produce antibody in the blood, and this is for your humoral or systemic immunity. T lymphocyte mature in thymus, that's why we call that T lymphocyte, and this is the one that responsible for cellular or localized immunity and also reject organ donation. This is because of the T lymphocyte, right? So B lymphocyte, B plasma cell, produce antibody in the blood. This is for humoral or systemic immunity. T lymphocyte mature in thymus. It responsible for localized or cellular immunity and also reject organ donation. So if somebody have ALL, acute lymphoblastic leukemia, or CLL, usually children ALL, elderly CLL. CLL is chronic lymphoblastic leukemia. That means in their bone marrow, there is a lot of lymphocyte. But if somebody have AML, acute myeloblastic leukemia, or CML, chronic myeloblastic leukemia, that means in their bone marrow, they have a lot of neutrophil, basophil, eosinophil. Those are white blood cells that have the granule inside. Alright, so this is the stem cell. Please memorize lab value. Average, right? RBC about 5 million. Ladies will be less because menstruation. If somebody not enough red blood cell, they have anemia, correct? And people that anemia will complain fatigue and chill, so they always tired and cold. When you look at their face pale, if you check their lab value, hemoglobin will be low. Hemoglobin normal should be 12 to 18, right? Hemoglobin low for people that anemia, and their hematocrit also low because their RBC less, right? Not enough RBC. So hematocrit and hemoglobin low for people that have anemia because their RBC low. And they are very pale. Check their conjunctiva or check their mucous membrane, right? For skin, dark color skin, usually easy to look at their mucous membrane in the mouth, right? Intervention for people that anemia because they always fatigue and chills. Rest in between activity, so don't do everything all together at the same time. They are too tired for that. Don't give them aircon room or the room not too cold, right? And they need blanket. So this is for people that anemia, always easily tired and cold, chills, right? Too much RBC, I call that polycythemia, right? And usually people that live in high altitude, because not enough O2, automatic the body will make more RBC to try to grab the O2, right? And if they have a lot of RBC, then they adverse effect is hypertension, and the blood become thick, right? Because too much RBC. So they still have to be careful with clot, even though this is not thrombocyte. So too much RBC also will make the blood become very thick. White blood cell, please memorize 5,000 to 10,000. If too low, then they risk for infection. Please know all the intervention. Okay, don't give them flour, don't give them fruit that you can peel, no pepper, yogurt, milk, because bacteria inside, right? Except probiotic yogurt. No live vaccine, avoid crowd, ask for sore throat, check their white blood cell, check the temperature. If 38.3 or more, report to doctor. Sign and symptom infection. Give them reverse isolation, means positive pressure room. If somebody's sick, don't visit them, right? Don't give them raw food, no salad. Do not clean cat poop. Give them water bottle only. So many intervention to prevent infection, because this patient have white blood cell low, risk infection. Don't forget your live vaccine. Don't give it to this patient with white blood cell low. And your live vaccine is your MMR, chickenpox, OPV. MMR, chickenpox, OPV, right? Mumps, measles, rubella, chickenpox, and OPV. Now we also have new live vaccine influenza, right? So follow the new finding. Thrombocyte, don't forget 150,000 to 450,000. Please memorize the number, right? If you see different book, different number, it's okay, because different lab, they have different method. They can a little bit different. But when somebody abnormal, they will far too low or too high, right? So example, some people have platelet only 20,000. That's already spontaneous bleeding, right? Or only 50,000 or only 90,000. That's way too low compared with 150,000. So if somebody low platelet, please worry about bleeding, right? Low platelet, thrombocytopenia, bleeding. So now the risk for bleeding, your intervention, please make sure you know all of this, right? Don't give them injection if possible, but if you have to, then use the smallest needle possible. Press 3 to 10 minutes until the bleeding stop. No IV if possible, but if you have to, then use butterfly that usually we use for baby, right? Lubricate the lip with water-soluble ointment so it will not crack and bleeding. Teach them to blow the nose gently so they will not bleed, right? If they go to dentist or surgeon, tell them to remind the dentist before pull their tooth, right? Soft toothbrush, electric razor, no spot contact. Remember, this is not contact precaution, okay? This is no spot contact, no spot contact. So teach them, don't exercise something that risk for injury. Give them stool softener. You don't want them straining and then bleeding, right? No enema, no suppository. Check their gum, check their urine. Maybe they have hematuria, hematemesis, they're vomiting blood, hemoptysis, their sputum have blood, melena, they have fresh blood in their poop. If I don't see the blood in the poop, maybe I need to do guayak test, right? Hemothorax, bleeding in the pleural space. Check their skin. I don't want to see petechiae, pinpoint. That's the skin, right? Under the skin there is bleeding. So know your petechiae. Bigger than petechiae is ecchymosis, that's bruise. And bigger than ecchymosis is purpura. Remember, this is for thrombocytopenia, right? Thrombocytopenia. When the thrombocyte low, the risk for bleeding. So I don't want to see petechiae, pinpoint, ecchymosis, bruise, purpura bigger than ecchymosis. Okay? Don't give them medication that cause bleeding like your anticoagulant, antiplatelet, NSAID, corticosteroid, thrombolytic. Those can cause bleeding. And we already mentioned about notify dentist or surgeon. Alright, so many intervention for people that thrombocytopenia. Make sure you know this really, really well. Okay, thrombocytopenia, the risk for bleeding. So for guayak test, please don't teach them, don't eat red, because you don't want false positive. No turnip, no red radish, no beets, right? No vitamin C, fish, cantaloupe, red meat, because you don't want false positive. Memorize your lab value, hemoglobin 12 to 18. If somebody pregnant and 11, that's normal for them. Okay, if pregnant. Hematocrit, please memorize 37 to 52. Ladies less, because usually RBC a little bit lower, right? If I centrifuge your blood inside the tube and centrifuge, it will separate the plasma, normal people 55%, and then the one that sink, that's your RBC, about 45%, right? So that's actually your hematocrit. So hematocrit average is 45%. So if somebody anemia, the RBC low, the hematocrit will decrease, of course, right? The white blood cell only 5,000 to 10,000, the thrombocyte only 150,000 to 450,000. That's why it's only white line in between the plasma and the RBC. Okay, so RBC, if you have normal, that's 45% average. People who have dehydration, the hematocrit look high, that's because they have less plasma. Okay, people who dehydration, their hematocrit high, increase, because they have less plasma. What hormone in kidney that stimulate production of RBC? That's your erythropoietin. What medication that mimicking erythropoietin? That's your epogen procrit, right? But be careful, if you give somebody epogen, they will make more blood, maybe make too much, right? So when they make too much, it will be hypertension. So monitor hypertension, it will not hypo, because they make more blood. If doctor order differential white blood cell, that means doctor want detail. How many percent neutrophil, how many percent eosinophil, basophil. So doctor want to know detail. So differential means what is the neutrophil, basophil, eosinophil, and how much the monocyte or macrophage and lymphocyte, right? Detail. So this is the neutrophil, 40 to 60%. So this is the most common white blood cell that we have to fight infection, right? So the job of neutrophil to fight infection. Also your monocyte macrophage also can engulf the germ, also fight infection. So neutrophil and your monocyte, right, Mr. Macrophage there, very important to fight infection. Basophil blue color increase when allergic. Normally only 0 to 1%. And this basophil produce histamine. When itchy, pruritus, right? That's because of the histamine. Treatment, antihistamine. This is your Benadryl, or generic is diphenhydramine. Please make sure you memorize this, right? Generic for Benadryl is diphenhydramine. This is your antihistamine. So when they have pruritus, urticaria, right? They have hives. Give them this diphenhydramine. But they will be sleepy, so teach them don't drive the car, don't use forklift, don't do something dangerous, because diphenhydramine usually make them sleepy. Diphenhydramine not only antihistamine but also anti-Parkinson. Alright. Eosinophil, this is a pink color, usually only 1 to 4% or 0 to 4%. Increase when parasite. But when allergic, it also can increase together with basophil. Especially when they have parasite infection, they can increase. And some medication can also cause eosinophilia, right? Too much eosinophil can be effect of medication. Monocyte, there is no granule inside, is a big giant cell. Macrophage, macro mean big, right? Phage means eat, they can eat the germ. So about normal, about 2 to 8%, under 10. And this is your lymphocyte, blue color, right? And lymphocyte, you do have T and B lymphocyte. Lymphatic system, why we call that lymphatic system? Because lymph, milky color, have a lot of lymphocyte. And lymph is the one that transport fat. That's why it's milky color, right? So this lymphocyte not only in the bone marrow, but also inside the lymphatic system, total 30%. And you have T lymphocyte for cellular or localized immunity, right? And reject organ donation, that's the T lymphocyte. And then your B lymphocyte produce the antibody, humoral systemic immunity, right? Plasma cell, that's your B lymphocyte. So T lymphocyte again, cellular or localized immunity, mature in thymus, that's why I call that T lymphocyte, and responsible for organ donation rejection, right? When somebody reject the organ donation, that's because of the T lymphocyte. So this is cellular localized immunity. And B lymphocyte produce the antibody. Antibody is inside the blood, it's everywhere. So that's why we call this humoral or systemic immunity, right? So B lymphocyte plasma cell responsible for humoral systemic immunity. Organ immunity. What are our organ immunity? Please memorize, select all the apply, right? Spleen, bone marrow, thymus, tonsil, lymph nodes, appendix, including appendix actually for immune system, right? If somebody have appendicitis, no choice, we have to do appendectomy, but it can affect their immune system. Peyer's patch in the intestine also for immune system. Okay, so know your immune system organ, right? Your organ for immunity, right? Spleen, bone marrow, thymus, tonsil, right? You also have adenoid behind the tonsil, that's also for immune system. Lymph node, appendix, Peyer's patch, right? Alright, let's talk about blood type, right? People have blood type A, B, AB, and O. But don't forget, we also have RH, positive and negative. Positive means foreign body. Remember, this is easy to understand. If you just remember, RH positive means have foreign body. That means foreign body. So you will never ever give somebody with positive foreign body, don't give it to somebody that negative. They cannot handle that, right? But if you give negative blood to the positive, that's okay. So, with that said, who is the true donor universal or negative? Because if they are positive, they cannot give their blood to somebody that negative, right? So the real donor universal is your O negative, and the real universal recipient that can receive me, gimme, that should be the AB positive. Because AB positive can receive from positive, can receive from negative. So whatever blood type, positive or negative, can give to this patient AB positive. The real, true, universal recipient. Alright, let's talk about blood transfusion. So LVN may assist RN when do the blood transfusion, but hang the blood, it has to be RN, right? So what LVN do? Make sure correct patient, make sure correct blood, don't give the wrong blood to the wrong patient, right? So assess, double check. Vital sign. The most important vital sign is temperature, right? For blood transfusion, the most important before, during, after, make sure always check the temperature. So to hang the blood has to be RN. We will use the needle that big 16 to 20 gauge, right? The smaller the needle, the smaller the number, actually the bigger the needle. Why? So the RBC will not damage, right? LVN and RN usually will stay in the room, especially the first 15 to 30 minutes is the most dangerous time, because if they will have a reaction, usually will happen during this time, right? If happen later, usually it's mild. So LVN usually the first 15 to 30 minutes have to stay in the room to assess, right? And RN will not give the blood right away a lot and fast. It will not like that. It will be slowly first, a little bit first, and assess, make sure there is no problem, right? So assess the temperature, vital sign, and you don't want suddenly, if the patient suddenly cannot breathe, itchy or red or cough, right? Whatever that you see not normal, quickly stop the blood, right? That's the first thing to do. And this always in the test, right? What should you do when you see something wrong? Stop. That's the first thing. And then call RN, call everybody, go and save the patient, make the patient stable, right? Maybe the patient need IV fluid, maybe need albuterol, diphenhydramine, maybe need what? Benadryl, right? So that's the diphenhydramine. So help the patient, save the patient, right? You already increase the head of bed when they cannot breathe, right? Once the patient already stable, then don't forget later return the blood and the spike, the tubing, everything, send it to the blood bank. Remember, send it to the blood bank. Because they need to investigate, like incident report, they need to investigate why the reaction happened. If this is already correct patient, you already double check the correct blood type, why it still happened reaction. So they want to make sure it will not happen again, right? So it's not to fire anybody, but to prevent so it will not happen again. If this blood you not yet use it, put in the refrigerator. And in 4 hours, if you still don't use it, return it to the blood bank so they can use it for other people, right? So usually once you receive the blood from the blood bank, you should already give it to the patient within these 4 hours. All right, so now all of this related to blood transfusion. Jehovah Witness, they usually do not want blood, okay, but ask them. Sometimes they are okay with plasma expander. Remember what is plasma? When I centrifuge your blood, it will separate. So the liquid part is the plasma, the RBC sink, right? So usually they don't want the RBC, but they are okay with plasma. So ask them if they want it, right? If not, maybe autologous. Autologous means their own blood. You take their own blood and then put in the refrigerator, and then when they do surgery, if they need blood, they will use their own blood. So usually they are okay with that. And the parent cannot decide for the minor unless they have the court approval, right? So let's say this is adolescent and the adolescent said, I don't want blood also, I also have this religion. They need to have approval from the judge in the court, and the doctor will follow that, okay? Let's talk about shock. Shock actually have hypovolemic shock. Maybe somebody bleeding, they become shocked. Can be cardiogenic because they have problem with cardio. Can be neurogenic because of the nerve problem, right? So there is many different type of shock. But shock, the early sign is tachycardia, okay? Whatever that cause shock, maybe bleeding, the early sign is tachycardia. Respiration also will go up. Don't wait until BP low, hypotension, because hypotension are already the late sign of shock, okay? Remember, shock means hypotension, late sign. And when they already hypotension, they don't have enough blood, of course it will affect their kidney also. Now they will have oliguria, right? Because not enough blood that go to the kidney, so the patient also have oliguria. What is oliguria? Less than 30 ml per hour urine, right? No P, no K, be careful. Less than 100 ml in 4 hours, or less than 400 ml per day. So people that shock, they also will have oliguria. Be careful, no P, no K. Alright, let's talk about anemia pernicious. What is this? Lack of B12, right? Generic for B12 is cyanocobalamin. Schilling test, that's for anemia pernicious. B12 radioactive, so don't use this for pregnant women. Vitamin B is very important for nerve. So if they lack of this B12, they will usually complain numbness and tingling. They can become paralyzed because the nerve, right? They can become dementia because affect their brain. So don't underestimate this condition. Don't think it's only lack of vitamin. It can be severe. Usually their tongue really red. We call that beefy tongue. And this happen a lot for people that do the gastrectomy. Ectomy, throw away the gaster. Maybe there is cancer in the gaster. Maybe they do the lap band, possible, right? In gaster, there is intrinsic factor that we need to absorb B12. So that's why if somebody do not have the gaster, right, they don't have intrinsic factor to absorb B12. And that's why usually they will have anemia pernicious. And they also will have dumping syndrome, right? And what is dumping syndrome? Dumping syndrome, their pouch small, or maybe they don't have the stomach at all. So if they stand up when they eat, the food will go down and they will poop, right? So that's why this dumping syndrome always in the test. Make sure you know this. When you feed them, let the patient lay down, but of course careful, I don't want the patient choking, right? But I want their intestine horizontal. And after feeding, I still want them lay down maybe 20 to 30 minutes, right? So the food can stay longer in the intestine, that horizontal, and the patient can absorb the nutrition. That's the goal, right? And don't give them too much water, because if they eat 1 spoon and then drink 1 spoon food and then drink, then you will flush the food down, right? So usually we give them fluid later. So give them just food first, drink later. And when they drink, don't drink too much, right? Low carb. Why low carb? This is important always in the test. Why low carb? Because in the mouth, we have amylase that break down carbohydrate. we don't have lipase or protease in our mouth, right? So that's why just give them low carb, because if you give them sugar, you give them carb, they will digest really fast. I don't want somebody with dumping syndrome digest the food too fast. That's why low carb is important. You can give high protein, no problem. You can give moderate fat, right? Don't give too much fat, and then they can have cardio problem or cancer, right? So low carb is important, high protein and moderate fat. And we already mentioned don't give them too much fluid, right? And small frequent diet for people that dumping syndrome. Why they have dumping syndrome? Because they cut the gaster. Doctor cut the gastric, right? The stomach, maybe there is cancer or maybe lap vein. So for people that anemia, pernicious, like B12, right? If you take their blood and you smear on the plate and look under the microscope, you will see that their RBC big and red, right? So macrocytic hyperchrome. Their RBC bigger than normal, and the color more red than regular. So remember this. Not only anemia pernicious that lack B12, but also anemia that lack B number 9, folic acid. Same thing, the RBC also will become big and hyperchrome. Okay, so memorize. Anemia that lack B12 and lack B9, their RBC macrocytic hyperchrome. This is when you look under the plate. You smear the blood at the plate and you look under microscope, you will see macrocytic hyperchrome for anemia that lack B number 12 and anemia that lack B number 9. Okay. So this is anemia that lack of B number 9. Pregnant women, make sure they have enough folic acid. Doctor will give them folic acid. Why? Because if they don't have enough B number 9, the baby can have spina bifida, right? So spina bifida means the baby when prone, you have to put them prone, right? Because at the back, at the vertebrae, there is pouch coming out, and maybe the spinal cord is inside the pouch, the meninges is inside the pouch. That's the worst case, right? Meningocele. So in the seal in the pouch, there is spinal cord, there is meninges. So this baby will risk for meningitis, will risk for paralyzed. So it's very dangerous, right? But sometimes they have spina bifida that only occulta. Occulta means only pouch, there is nothing inside. So that one is easy to deal, right? But cystica can be meningocele, can be myelomeningocele. Meningocele, the pouch only have meninges, but they still risk for meningitis. The worst is myelomeningocele, because in the pouch, cele means pouch, right? Have meninges, so they risk for meningitis. And myelo, this myelo is spinal cord, right? It tangle. Now the CSF cannot flow. That's why 80% of them usually have hydrocephalus. Okay, so this baby with the neural tube defect, spina bifida, that myelomeningocele, usually 80% hydrocephalus, and this baby usually allergic to latex, right? And people that allergic to latex, they usually allergic also to fruit. And the mnemonic to remember easily is BP pack, right? BP pack, let me show you: banana, pineapple, passion fruit, avocado, chestnut, and kiwi. Okay, banana, pineapple, passion fruit, avocado, chestnut, kiwi, BP pack. People that allergic to latex, they also allergic to this. Also potato, tomato, strawberry, and peach. Okay, potato, tomato, strawberry, and peach, BP pack. So use your mnemonic, okay, when you study, so you can remember a lot, right? BP pack: banana, pineapple, passion fruit, avocado, chestnut, kiwi, potato, tomato, strawberry, and peach. And for what is this? For people that allergic to latex, they usually also allergic to this fruit, because the chemical in this fruit similar like chemical in latex. All right. So why the baby can have this neural tube defect? Because when mom pregnant, not enough B number 9. So doctor will make sure that all pregnant women have enough vitamin B number 9. Usually we will give them 400 to 600 microgram, right? That's the dosage for B number 9. All right, now let's talk about the bone marrow. Okay, bone marrow. where we got bone marrow, if somebody need transplant bone marrow, we get it from pelvic area and sternum. Okay, two places that usually we can take the bone marrow and donate, give it to people that leukemia. Usually leukemia, they need help, they need transplant bone marrow, right? So where we get the bone marrow, either you get from pelvic, that's the best place because thick, big bone, right? Or you can get it from sternum. Alright, what is hemophilia? Remember X-linked, right? X-linked means mom give it to the son. If mom have this one gene, mom only carrier. Mom do not have sign and symptom or only mild, right? But mom give the bad gene to the son, right? XY, Y from the dad, and the X from mom that have the gene, right? So for the son, it will show sign and symptom. So we can say that only the male have the hemophilia, right? Usually only male that have hemophilia or really sign and symptom really strong. Ladies, if they have sign and symptom look like hemophilia, we call that von Willebrand, right? We call that von Willebrand, or now usually we call that hemophilia type C, so it's very mild. But basically it's the same, they lack of clotting factor number 8 or number 9. Okay, remember this. Hemophilia means they lack of clotting factor. If clotting factor number 8, I call that hemophilia type A. If they lack of clotting factor number 9, we call that hemophilia type B, right? So please monitor bleeding, don't let them injury, because if they injured, they bleed, right? So this is about bleeding. When they need blood transfusion, what they need is frozen plasma. Remember this one always in the test, right? Do not give them whole blood. Do not give them packed RBC. That's not what they need. Do not give them thrombocyte. They don't have problem with thrombocyte. What they need is plasma, because clotting factor number 8 or clotting factor number 9 is inside the plasma, right? And when we store the plasma, we make it frozen. So that's why the answer will be frozen plasma or cryoprecipitate, right? Cryoprecipitate means we make it precipitate and in cold temperature. Cryoprecipitate or frozen plasma. Teach them if they have joint problem, joint pain, report, because that's usually bleeding at the joint, right? And you can teach them if they have pain, they can use ice pack, they can elevate their leg. Okay, so you remind them possible that they can have joint pain, but they can use ice pack to reduce the edema, right? And they can elevate the leg, right? Elevate the whole thing, not only half, right? Because you don't want bleeding at the joint. So this is about hemophilia. If you see the word Rich-Steinberg cell, that's guarantee Hodgkin. Okay, Hodgkin is the cancer, and usually they only fatigue, only tired, right? And then they have bulging at the cervical area, cervical lymphadenopathy, and usually painless. And when doctor order for biopsy, if they find Rich-Steinberg cell, that means it's Hodgkin. Only Hodgkin have this Rich-Steinberg cell. So cervical lymphadenopathy, painless, very tired, fatigue, right? But prognosis is good because we find the cure for this Hodgkin, right? It's very important to know the staging, because staging will decide the treatment, right? Stage 1 and 2, radiation. Stage 3 and 4, chemo, right? So stage 1 is the one that only one lymph node above the diaphragm. Stage 2, if more than one, right? More than one lymph node affected, but it's still above the diaphragm. Stage 3 is already affect the upper and lower part from the diaphragm, right? So above and below diaphragm, that's stage 3. And if already metastasized everywhere, that's stage number 4. So staging is very important because staging will decide the treatment. Stage 1 and 2, radiation. Stage 3 and 4, chemo. Or sometimes doctor will give chemo and radiation, both for 3 and 4. If you see the word Benz-Jones protein from the 24-hour urine sample, this belong to multiple myeloma. Okay, multiple myeloma, multiple more than one. Oma is cancer, myelo is the bone marrow here, right? This is myeloma here is the bone marrow. So Benz-Jones protein from 24-hour urine sample. So myelo can be The meaning of myelo can be the bone marrow, can be the spinal cord, right? But here, myeloma here is the cancer in the bone marrow. Let's talk about iron deficiency anemia. They usually, without they realize, they love to chew ice chips, right? And why? Because they have glossitis, itis in the tongue. So when they chew the ice, they feel comfortable, right? Don't forget, if somebody anemia deficiency iron, they have microcytic hypochrome. So if I take their blood and smear at the plate and look under microscope, I will find that RBC small and pale, right? Microcytic hypochrome. Please memorize. Iron deficiency anemia, microcytic hypochrome. Small and the color less, right? Microcytic hypochrome. People that deficiency B12 and B9 is the opposite, macrocytic hyperchrome. The cell, the RBC big and the color more red. That's for that's for anemia that lack of B12 and B9. But the one that lack of iron, microcytic hypochrome. So give them iron and teach them. If you give them iron, the stool will be black. Don't freak out, right? That's normal, black stool. They can risk for constipation. So tell them high fiber and increase fluid, right? And when they take iron, the best is empty stomach. But if it's irritate their GI, then take it orange juice, vitamin C, or take it with food, right? Don't drink with milk. Do not take with milk. With milk, yes, not milk, right? So when take the iron, the best is empty stomach or vitamin C, orange juice, or with food. All right. And many times after delivery the baby, because the woman lost the blood about 350 ml, usually doctor will give iron because iron is the material to make RBC. And iron that liquid, it will stain the tooth. So take with straw, right? And of course, don't rinse your mouth with iron, then everything dirty, right? So after iron, use water, rinse the mouth. So it will not discoloration to the tooth. If the person need the iron urgently, then we use C-track, right? So C-track is the one that you use the needle with 1-inch needle long, right? The bevel, make sure it has to be clean, no iron at all, because if the iron touch the skin, it will be burned, right? And discoloration. Usually when we prepare the iron, purposely we put 0.1 ml airlock. Don't release the air. Don't be afraid with air emboli, right? We purposely put airlock there a little bit. So later when we give the injection, it really go inside and it will not come out. It will not touch the skin. So how to do C-track? Hold the skin very tight laterally, right? Lateral. And then give IM. Inject the medication slowly. IM means 90 degree, right? So use the muscle that no blood vessel. Because if you make sure blood vessel that no blood vessel under the area, so you don't need to aspirate, right? So after you inject the medication slowly, wait for 10 seconds after you inject. And then when you withdraw the needle, release the skin to seal the tract, right? And do not massage. All right, one more time. You use the needle that 1-inch. Make sure the bevel have to be clean. There is airlock 0.1 ml. Don't release the airlock, right? They purposely put air there. You hold the skin very tight, lateral. You give IM 90 degree. Inject the medication slowly. Wait for 10 seconds. Then you pull the needle and you release the skin to seal the tract, right? The reason why you wait for 10 seconds, so when you release later, it make a zigzag, right? So the medication will not easily come out. That's the point. And do not massage, because if you massage, then the medication will come out and burn the skin, right? So this is how to do the C-track. Iron diet, teach your patient shrimp, oyster, peas, cream of wheat, eggs, prune, broccoli, beef, and chicken have a lot of iron. So sometimes you have diet question, right? Iron. All right, sickle cell anemia. Autosomal recessive means mom and dad guilty, right? If mom give one bad gene and dad give bad gene, then it will be sick, right? Carrier is the same with trait. Remember, carrier is the same with trait, means they have one good gene and one bad. So they don't have sign and symptom, right? So one good gene and one bad gene, that's carrier or trait, they don't have sign and symptom. The problem is if carrier married with carrier, right? And now if mom give the bad gene and dad give the bad gene, then the child will have the disease. Sickle cell disease means they have sign and symptom. So this only can happen if mom have one bad gene and dad have one bad gene. So we call this autosomal recessive. Both parents guilty. Because impossible if one parent totally healthy and the other one carrier, impossible will have child with sign and symptom. All right. And because this is anemia, they don't have enough RBC, right? Their RBC not normal, so usually they will need blood transfusion. Their hand and feet can be swollen because the blood vessel in that area clumping, right? And this sickle cell clumping everywhere, it can damage all organ. So every time when you see the word sickle cell anemia, remember HOPS. This is the mnemonic, right? To make you easily remember the information. HOPS, avoid heat. When summertime, when fever, be careful, they dehydrated, they can easily have attack, right? Hydration is very, very important. Give them a lot of fluid so the sickle cell will not clumping, right? Give them O2. Pain management is very, very important because their pain usually very severe, excruciating pain. They need morphine. All right, don't use Demerol because Demerol can have a cumulative effect and then seizures, right? So for this sickle cell crisis, the pain is very, very bad. They need morphine. And then teach them to avoid stress, okay? Avoid stress because when they stress, usually they don't drink, they dehydrated and then attack. 3 different stages. Stage number 1, vaso-occlusive, very, very painful. The test will ask you why so painful, because occlusion in the blood vessel. So what they need here, the priority, pain management, morphine, right? And if no answer pain management, then hydration. So it will not clumping. Stage number 2 is sequestration, splenomegaly. Your priority here is do not palpate. You have to avoid rupture. Do not let the spleen rupture. There are 2 diseases that you have to know that can cause splenomegaly. One is sickle cell anemia and the other one is mononucleosis infecciosus, right? Mono, that's the one that kissing bug, Epstein-Barr virus, right? So 2 diseases that usually can cause splenomegaly. One is this one, sickle cell anemia, and the other one is the mononucleosis infecciosus, kissing bug, EBV, Epstein-Barr virus, transmit via kissing. Okay, so when somebody has splenomegaly, do not palpate, stop fidgeting. We usually tell them stay in the bed, don't move too much because the spleen can rupture, right? And doctor usually will do the splenectomy, throw away the spleen rather than it rupture and then patient died. Because this is a lot of blood. You don't want the blood go to the peritoneal cavity and then they have peritonitis, right? So usually when the spleen way too big, doctor will do the splenectomy because usually will take longer time until it's shrink and small again, right? Stage number 3 is aplastic, and aplastic means all the cell already low. RBC low, anemia, white blood cell low, risk for infection, thrombocyte low, the risk for bleeding. So this is already stage number 3, aplastic states. So 3 different states, vaso-occlusive, sequestration, and aplastic. Priority in the first stage is pain management. Priority for second stage is do not palpate, do not rupture the spleen. And stage number 3, they already have all cell too low, right? They have anemia, risk for infection, and risk for bleeding. So this is for sickle cell anemia. Remember your HOPS, avoid heat, hydration, O2, pain management, and avoid stress. All right. Autosomal recessive, mom and dad guilty. All right. So what is leukemia? Let's talk about leukemia, right? In the bone marrow, they have a lot of immature white blood cell, even though a lot, but they cannot fight infection. So we call this shift to the left. Shift to the left means a lot of babies white blood cell, right? And because the space full with white blood cell, they don't have enough space for RBC, so this patient also will have anemia. And not enough space for thrombocytes, so the patient also thrombocytopenia, risk for bleeding, right? So people that leukemia, their white blood cell a lot but cannot fight, so they risk for infection. Their RBC not enough, so they anemia. Their thrombocyte not enough, so they also risk for bleeding. So they have everything just like aplastic anemia. And they complain bone pain because this is bone marrow inside the bone. And they walk limping because their bone is not healthy, right? So that's why they need bone marrow transplant. Usually we give them medication to just kill all the bad bone marrow, and then we give them the new healthy bone marrow from other people, right? That donate the bone marrow from the sternum or from the pelvic. And because this is cancer, doctor will give radiation and chemo. Okay, for leukemia. The most common leukemia for children is ALL, acute lymphoblastic leukemia. So in bone marrow have a lot of lymphocyte. And the one for elderly, the most common is CLL, chronic lymphoblastic leukemia, right? So in the beginning, they have acute lymphoblastic first, but then happen again more than 6 months. So we call that CLL, chronic lymphoblastic leukemia, elderly. All right, almost done. Lymphedema. So lymphedema is their lymphatic system edema, right? Especially people that they just have mastectomy. We tell them always raise your hand, right? Raise your hand because there is no lymphatic node anymore. They easily can have edema, swollen, right? When somebody edema, the water is in the interstitial space. Don't give injection if they have swollen in that hand, right, in that area. So don't no injection. Teach the patient elevate, and we can do the massage, right? We can do the massage for the lymphedema. Usually the patient will complain why they cannot wear their regular ring that they usually wear. That means it's swollen, right? So many times this happen because they have lymphedema, edema at the lymphatic system. And we teach people after mastectomy, because this is radical mastectomy, we teach them always protect your hand, use mitten when you cook or when you gardening, because you don't want easily get infection, right? So infection, lymphatic system, we call it lymphitis. If you see their hand is like there is a red streak, right, line, so then you that's how you recognize that's lymphitis, infection, inflammation at the lymphatic system, right? There is line at the hand or feet, right? Lymphitis. So lymphitis is inflammation lymphatic vessel, right? Inflammation lymphatic vessel, we call that lymphitis. Let's talk about MRI. All right, MRI, right? This is usually already included in general consent. So when the patient go to the hospital and they sign admission for the hospital, that's usually already automatic include X-ray, Foley catheter, MRI. So I don't need to ask them permission anymore, right? Again, right? This is what we call general consent. So unless later if they need lumbar puncture or amniocentesis, something that's special, then you have to ask for specific consent. So MRI usually include in general consent when they admitted in hospital. No metal, no pacemaker, no prosthesis, right? Whatever metal, not claustrophobia, not confused, right? The patient have to be alert oriented, not schizophrenia, and teach them. They will hear banging sound. They have to stay quietly inside 30 to 45 minutes, right? Depend on what doctor want to see. So tell them this is the rule for MRI, right? The size not too big because they have to go inside the tunnel. So know everything related to MRI. And the end. So this is the review for your hematology. I hope this is useful and good for you. All right. That's it. God bless you. See you next time. Bye.